scary as hell, as you guys know, with this COVID stuff. So the most things we've found out are nobody knows, and when we think we know, they change the rules. And so I think of this event for us as a sick patient who's dying. They're in critical care, and we're the doctors, so we have to have good monitors in place to keep this patient alive and provide good medications or treatment plans to get things going to keep this patient running through this illness that we're having for us business-wise. And so I'm going to hand it off to Jolene, and she'll get started, and we'll see how this goes.
So the first thing we did when this came about was we really put our forward-thinking hats on. And we thought, where is this potentially going to go? And let's forecast for that. So we obviously took the immediate measures right away of increasing sanitizing and measuring and measures to ensure the CDC standards. And then we screened patients, staff, and doctors at the door for any fever or respiratory issues. We rearranged the waiting room to allow for the 6-foot distancing. Obviously, this kind of came in different time frames based upon the regulations and how they were set. And we're in Washington State. I don't know if we have any out-of-staters on, but so we kind of had different measures day by day, sometimes hour by hour. So staying up with it, was a little difficult in the beginning. So some of the things we've done is we created some designated clinic hours for higher risk patients or those that are less comfortable coming into the office with patients in the waiting room. And we, as I said, we took immediate action on financial projections with a best case to worst case scenario. We have about 4 different scenarios and started brainstorming action plans for those. And so we came up with kind of this threshold, we're going to hit this next action plan, and then this next threshold, we'll hit this next action plan, all the way through to a worst case scenario, because even now, we don't know how long this is going to last or what it's going to look like. And then we reduced our staff hours across the board to try and keep all of them working. So instead of laying staff off, we just tried to balance that out and reduce hours and then allow them to collect unemployment to supplement their income. We consolidated some clinic hours to reduce gaps in the schedule. And we are also doing recalls on patients that we haven't seen in a few years, trying to get them on the schedule, if not now, at least 2 months from now, or wherever we can get them on the schedule so that we're filling the schedule for the future. Because as you know, if you have a decrease in new patients, we're going to have an issue in a couple months on what that looks like. So that is one thing we've really been hitting hard on, is recalling those patients and getting them on the schedule. And then, of course, we're continuing to market and do some fun things through social media platforms, just for our community. It's a really heavy time right now, so we want to be not only a source of health and well-being for our patients, but also a source of inspiration wherever we can. So we're doing some of those things. Part of our mission is to improve the quality of lives, including our community. So we've partnered with 2 community agencies to be a food and supply drive drop-off place, so that it's convenient for people to contribute that are coming to their doctor's appointments or coming to work. And some of the things I would just recommend is make sure you have a plan for your practice and manage your cash flow. Forecasting is really important. At this time, you really want to accelerate your AR and decelerate your AP. Accelerate your accounts receivable and decelerate your accounts payable. Eliminate any and all unnecessary spending and expenses. Reduce your inventory and expand your line of credits. Be sure to tend to your patients too. So they're going through a hard time through this too, and we want to make sure that we're able to accommodate them in any way that we can. I have actually sent out several communication letters to the patients in ways of social media platforms, email campaigns, and real letters. Kind of sharing with them, hey, if you have an accommodation that you need to come into our office, let us know and we'll see if we can meet that, so that we create as much comfort for them to be able to come into the office and get the treatment they need so that they don't have an issue later. And then also, for those of you that have staff, remember, they're the people that help make you successful. So one of the things that we found is communicate, even if you don't know what's going on. And if you feel like you're over communicating, there have been so many staff that have told us how grateful they are that we are communicating with them as much as we have been. And they've also shared that other people aren't, and they probably aren't because they don't know what they're going to do in their business or what moves they're going to make. But even if you don't know, just communicate with your staff. That's so important. Understand your value proposition in your marketing. And this is a great opportunity to figure out how we can increase our value. At this time, we did something simple like just hand sanitizers for our patients, just to create a little extra value for them coming into the office. Think about what you can do to create extra value at this time. And then last but not least, probably one of the most important factors, make sure that you are monitoring what drives your business. Make sure you're looking at your metrics. Make sure you're looking at your patient loads every day. Make sure you're looking at your new patients so that you know what areas of those early warning signs you're starting to look at so that you can start to make a proactive plan for that.
As podiatrists, we've been doing this from yesterday, today, tomorrow, but this moment in our practice careers is going to leave everything changed. So 6 months from now, when everything's back ramped up and we're kicking ass again and everything's good, I think we can anticipate that we'll be doing things differently. Telemedicine will be a forever new part of our practice. And so this is what we're trying to think of on our scheming meetings to see how this is all going to look then, not just today and tomorrow, but 6 months down the road, a year down the road, so that we're prepared, ready to roll out whatever's coming our way so we can be on the front lines to make it better.
It doesn't sound like any of the banks are actually going to help you do the calculations. So when it goes into my piece, I'll show you how we're doing the calculations ourselves and the pieces involved in it. And if you all actually have to do that on your own, then at least you can follow some of my instructions and hopefully that can help you out. So my name is Brian Alvarez. So my focus is only going to be on the Paycheck Protection Program. There are a number of things out of the CARES Act that it's possible that you all may be able to take advantage of. I'm not sure about everyone's unique situation. So I'm only going to focus on that one program. And all of my, and I have a bunch of PDFs that I'll share with everyone as well. So all of my data is from government sources or like the Chamber of Commerce, just because I've been hearing kind of like just misinformation around, right? So I just want to share with you the information where it came from and how I will be doing the calculations, right? So I have a lot of my data already, so I'll be up really early tomorrow morning just in case the application really is out there for me to fill out. I'll be able to fill it out. So just to start off, so I will share just the Word document first. And like I said, we'll share this afterwards in case you want to use any of the links, bring up any of the documents. Right here is a lot of the links that I'll be sharing with you all. So you see the actual Paycheck Protection Program application itself, and I'll go into detail for all of these. The Treasury fact sheet, this is a wonderful document. If you all have not looked at this document, this to me is the best source. And again, this is straight from the Treasury's website, right? The Chamber of Commerce does a really good job as well. Then this is the actual statute itself, the actual law that got passed with only the Paycheck Protection Program section, right? And then I have a list of the biggest SBA 7A lenders, just in case you haven't found one yet. There's a list of all the different lenders that you can choose. I can tell you we are using Wells Fargo, and they will not lend to anyone that has not already been one of their customers. So if you weren't a customer with them, you're out of luck. But there are a lot of choices that are out there. I had heard about US Bank being one of them that you may be able to reach out to. This right here is the Accelerated and Advanced Payments fact sheet. That's one of those items that I mentioned. I'm not going to go into in detail, but I think it is good for you all to know. So it's good stuff right there. And then this is a link to, this one's the only non-government website right here. I just thought they did a really good job at calculating your loan amount and how you could figure it out. And they have some really nice examples on there. So I'm going to go into some of the Treasury fact sheet there. So this is the application itself. It's really easy, really straightforward. If you all haven't seen it yet, again, the link is on there for you. You'll be able to look at it. This is just step one, right? It's a multi-step process. Step one is fill out the actual Paycheck Protection Program application form. But then step two is turn in all the documents that your lender is requiring. This piece is really easy, right? You're putting in your name of the company, your EIN, and then you have to figure out your average monthly payroll. This document itself doesn't do a great job at helping you out when it comes to that, right? It gives you the information right here of some of the stuff. I myself prefer, this, there we go. This is the document from the Treasury Department. So this goes into more detail, and on page 2, it goes into what counts as payroll cost, right? So this has been one of the areas that I've really been hearing kind of misinformation, which it confuses me a little bit because it's literally in this document and it kind of tells you what makes up payroll. So this is the actual document. I'm now going to go over to my Word document because I kind of prefer sharing that one because I have it a little bit written out a little bit differently. So I'm going to scroll down below here. So documents needed to apply right here. You need your payroll register. So that is generally something that you'll either grab from your accounting software or you'll be taking it from some outsourced service, right? So you'll be grabbing your payroll register, then your transcripts for your payroll taxes paid, and then these two items right here, the financial statements and transcripts for payroll taxes paid, was actually requested of me from Wells Fargo. Wells Fargo actually said, hey, Brian, you're going to need these documents. Even though it's not stated in the government paperwork, Wells Fargo told me that. So I do recommend that you grab those documents. And then how do you calculate your loan amount? So again, it goes through wages, right? So you have your salary, wages, commissions, or tips, and it's capped at $100,000. So that would include yourself if you're an employee at your company. So let's say you pay yourself $150,000 a year. Only the first $100,000 is going to count. Anything over that $100,000 gets thrown away, okay, gets put to the side. And then you have your employee benefits. So I kind of restated down over here. So that's your health insurance that the company paid, not the employee's portion. Your retirement benefits such as 401k match and SUTA. So SUTA is your state unemployment. That's the one that ADP does a really bad job because they don't have a document like that that tells you that. There is a combo bill that you can actually figure out how much in SUTA you paid. So I already know these numbers, right? I know how much in SUTA I paid already. I know how much in 401k benefits that we matched and health insurance. So I have all that documentation already because it is in the ADP combo bill. So you take those pieces and then let's say that when you total it up for a 12-month period, so you total up all those different wages over the previous 12 months. So the way that I would view it probably is like April 1st, 2019 to March 31st, 2020, just a couple of days ago, right? So let's say during that 12-month period, you had about $1.2 million in your salary, wages, employee benefits, and your SUTA. So you then divide that by 12, and that's your average monthly payroll, $100,000 a year. You then multiply that by 2, or really the easiest way to do it is multiply by 2.5. But if you actually follow all their steps, technically if you multiply that by 2, then you take that number and you multiply it by 25%, and then you add that 25% to your top total. Again, the same thing is simply multiplying your monthly average by 2.5. That gets you the exact same number. So that gives you $250,000 at that point. So then after that, you then would calculate your loan for this, $50,000. You can now use that $250,000 on only 4 different items. Payroll cost, again, payroll cost is made up of salary, wages, employee benefits, and SUTA. And if there's some local taxes that you actually pay based off of the amount of wages that you pay your employees, that would also be included. We don't pay any of those, but if you do, you would include that as well. So what is not included though would be FUTA, which is federal unemployment, and payroll taxes. Neither one of those would be included. Then you would also include, if you happen to own the building that you reside in, you could include the interest payments on that building. If you rent, then the rent payment, as long as you have a lease agreement, and then also any payments of utilities, and that's electricity, gas, water, transportation, telephone, and or internet. So that's really important. Then so let's say that covers all of your 250,000, then you're good to go. You're going to have your loan forgiven, but it does get reduced. And that I don't have on here because I thought the Chamber of Commerce did a really good job with that document. So here's the Chamber of Commerce right here. So as you see, reduction based on reduction of number of employees. So you have your payroll costs that are right here. Then you have your average number of full-time employees, FTEs, per month for the 8 weeks beginning on loan origination. So let's say you managed to get the loan originated on May the 1st. So you would look at the amount of employees that you had in May and the amount of employees in June. You divide that by these numbers over here. So you pick either or. So obviously we're not seasonal. So we'd either pick option 1 or option 2. You're going to pick the option that you had the least amount of employees, because obviously then that would mean this number over here, you'd have a much higher likelihood of being at 100%. So you would either take it to your total numbers of FTEs per month in January and February of this year, or the date range of last year from February 15th to June 30th of last year. So keep that in mind, that's FTEs, right? So if you have a part-timer is not an FTE, they're a part of it. So if you have multiple part-timers, maybe 2 of them equal 1 FTE. So keep that in mind when you're figuring it out. I'll tell you the way that I'm doing it is I'm doing it based off the amount of hours worked. So let's say that I have let's say we have 4 part-timers. One's 25 hours, another's 20 hours, another's 30 hours, and another's 20 hours, right? I'm going to combine all those hours. I'm going to divide it by 40, and that's going to tell me how many FTEs I have of that. That seems to be the most logical way, and I think that would protect you from any issues from the government. I mean, that's a logical way to calculate that number. So that's one of the ways that you would get reduced. The second way that you would get reduced is if your payroll cost. So if you're paying an employee that's making less than $100,000, 25% less now when they come back than what you did prior, they will then reduce your payroll cost allowable by that amount. So what does that mean? So we'll just choose $50,000 as a number. So let's say before we had an employee that was getting paid $50,000, but now they're getting paid $30,000. So only 60% of what they were getting paid before. So that $20,000 difference is going to be reduced on your payroll cost. So that's going to reduce the maximum allowed that you could possibly get. So those 2 numbers right there would reduce the amount that you could get loan forgiveness for. So going back into here, I thought if you end up really wanting to look at a bit in some detail as well, I thought this is a good site that can help you out with some of those examples. I put an example right here, right, so that you could figure out how to get to your loan amount. But when it comes to the forgiveness, I thought this site did a good job with that. So I would really recommend that. So if you all have any further questions, this was just a really quick rundown, but if you all have any other questions, feel free to ask afterwards. But for now, I'm going to hand it off to Jamie.
I'm the administrative manager for FASA, so more on the scheduling side, making sure that we're getting as many patients in, or even converting them over to e-visits and everything else. We have implemented that every patient that actually calls in to cancel, if it's due to the current circumstance, or even if they're just sick, we have implemented that 100% of those are offered an e-visit. And it's really just the way that it's delivered to the patient, because if you ask them if they want to convert it to an e-visit, then it gives them the option to say no. So we're really working towards just letting them know, well, the doctor would still like to, talk to you and see how you're doing. So he'll be calling you Tuesday at 2:30. So we're really trying to go that route because then it gives them less of an option, I guess, because that is an option for the doctor to still check in on them and make sure everything's going okay, with the convenience of them to stay at home, you know, regardless of self-quarantine and not wanting to leave or whatnot. So that's one thing that we've been working on. As Jolene mentioned already, that we're also doing recalls. Something all practices should really do, you know, for their diabetic patients, for anyone that they do surgery on at some, you know, at some point, those patients should be following up. I know that like on normal, you know, when business is as usual, some of those things can kind of get dropped a little bit. So this is really a good time to come back to those things because you have the time and your schedule allow, you know, and you're there ready to see the patients that haven't been coming in. So the recalls are really heavy with us right now. And then another thing that we have started to implement is really just even within the treatment rooms, the doctors talking to the patients while they're there about their family and maybe, you know, whoever brought them in, you know, just to see what's going on with them because, you know, some of these conditions are hereditary. So that's another thing that's kind of helping because, as you know, a lot of primary care offices and whatnot, they have restricted hours or some of them are closed. So referrals aren't coming in like they usually are. So that's just another way that you can try to, you know, fill the schedule. And obviously the people that are in the office, they're not afraid to be out and about. So if they're there, then chances are, you know, their spouse or their kids or whatnot are going to be there too. So those are some things that we're really trying to do for that. That's really it. Just we're really trying to convert the e-visits. There are some appointments that the patients are like, well, I'm coming in for foot care. It's not really anything necessary for the doctor to talk to me about. So we're trying to, I mean, this is new territory for all of us. So we're really trying to do it the best that we can. But just letting the patients know that we are there for them and it's convenient for them to, you know, still talk to the doctor about any concerns.
So I'm just going to go over the telemedicine, what we've been implementing and how we've been rolling it out. Basically, it's continually to stay on top of all the changes. Seems like every 24 to 48 hours, there's something new coming down the pipeline. As soon as you think you know it, it changes. So I'm doing my best to try and just educate the doctors and the scribes. And then again, it is converting a lot of those cancellations to e-visits or telephone calls or however we can to get the doctor communicating with that patient to ensure that their care is not dropped and letting them know that they are just as important during this time. So I do have one thing I'm going to share with you guys. I'm going to share my screen, so bear with me a minute. Okay. So I do have a little thing about telemedicine and how can we help our patients during this time. Telemedicine, telecommunication, and e-visits are basically all the same thing. The words get thrown around quite a bit of what is what, but telehealth, telecommunications, e-visits, they are just a safe alternative for us providing care to the patients during this time. There's multiple options for telehealth. There's telemedicine, virtual check-ins, telephones, and online E&M. Medicare has thankfully reduced our restrictions on what we are allowed and are not allowed to do right now. We are able to do live audio, video communications through FaceTime, Skype, Zoom, Google Hangouts. And then they've also released as of 2 days ago to where it's no longer an audio and video requirement. Now you can just have audio. So that does count as just a phone call to the patient. So here I have outlined a couple of the things of the differences of telehealth, virtual check-ins, and then online digital E&M services, as well as telephone visits. Everything needs to be documented just as if it was a face-to-face visit. It's super important that we continue to document with including everything in it. And also, another thing is that I've read a lot about and that Medicare has suggested is that in your care plan at the end of your note, be sure and document that it was an e-visit that was provided during the COVID-19 pandemic. The reason for that is in the future, in a year or two down the road, if there is an audit, those documents that were done during that time will have that statement in there saying when it was done and what exactly was going on in the world. Services for telemedicine visits is, like I said, different options are patient portals, FaceTime, Zoom meetings, Facebook Messenger, Skype, and as well as Google Hangouts. most patients do have some kind of interactions. Even a lot of times your 80-year-old patients, they do have smartphones nowadays. So we've seen with our doctors some of the things where we want them to do telemedicine visits, but they're stuck because of what do I do? What do we see them for? So I outlined a couple items that you can easily see a patient for in telemedicine, following up on their inflammatory conditions, following up on injections, orthotic, 1-month follow-up, see how they're doing, follow up on physical therapy if you referred them out, diabetic checks, questions with their shoes they may have, and just reiterating the importance. So we've seen quite a few patients that if they were scheduled to come in for nail care, they at that point are like, I'm canceling, I don't want to go out in the world, it's not safe. And then if we offer them an e-visit, they're like, I have no reason to be seen. So one of the things that we do try to reiterate to them if they are diabetic is your care is still important, and it's still important that we discuss the things that you need to be done. So we have seen where patients do enjoy that sense of, wow, they care. So just checking in with them, making sure that they're still controlling their glucose and they don't have any instability when they're walking. And then post-op, as long as you're past that, the sutures being out, if they're in the point where they're transitioning from a boot to a shoe, easy time to do an e-visit and just go over your instructions that you have specifically for that transition for them. Simple at-home range of motion exercises, post-op nail procedures, reviewing of any labs, CT results, MRI results. These can be done easily through telemedicine, 6-month follow-up on your fungal nail treatment, just to see where they are at. And then, so the most important part is the billing. So as of 2 days ago, we are now able to bill 99201 through 99215, with your place of service being where the visit would have been held. So if you are doing the e-visit at an office, it would be place of service 11. If it would have been, say, example, nursing home, you're going to have like a 32. 95 modifier was not required, and as of 2 days ago, it is now required. So place of service will be 11 if it would have been, if that visit would have taken place in the office with a 95 modifier. When they made the changes a couple days ago, the previous telephone E&M visits that were being billed for phone calls, the 99441 through 443 codes, now they are saying they are non-covered because they want us pushing out with those office visits. They want us pushing the 99201 through 215. And then they did release also for us to be able to see new patients as well as established. And then virtual check-in is one of the easiest ways to explain it is communication back and forth through a portal for a patient, or if they're emailing you back and forth or they're texting you back and forth, that can be billed out if they do have Medicare Part B or the Medicare Advantage plans. It's 5 to 10 minutes of medical discussion that's between you and the patient, and it's a matter of over 7 days for that 5 to 10 minutes adds up. Online digital E&M service is it's an option that a lot of places such as like Multicare does, and it's a questionnaire that you're going to go through, you fill out, and it kind of guides as the patient, and it guides them to whether they need to come in for a visit, they need to call your office, or if you need them to then come in. After they've done that, you can bill them for that online digital E&M service if your EHR does offer that. A couple websites that do offer different resources right now. Another thing that came out, Washington Healthcare Authority is offering no-cost Zoom accounts for providers if they are unable to afford it, unable to have the resource. They are offering that as a resource right now for us. Additional codes that were added. So we can now do E&M visits that are telemedicine for your initial hospital evals, your subsequent hospital evals, and your nursing homes as well, and then for initial and subsequent. The current insurance that are following suit with Medicare and Medicare Advantage plans are the Washington State Medicaid plans, Blue Cross Blue Shield, Premera, Aetna, Multicare, Medicare Part B and Medicare Advantage plans. VA, TriWest, Care for Life, and Champ VA have all authorized to do telemedicine visits to cover them. Cigna, United Healthcare, Humana, Regent, LNI, First Choice, Lifewise, and Physicians of Southwest, and Teamsters. So we do have quite a list of different insurances that are providing the coverage at this point. And then just we're keeping up with it. It's important that we continue to watch it because it's changing day by day, it seems like. And then as soon as we learn something, it's something new. So just staying in communication with the doctors and staying in communication with the staff. All of our doctors in office have my contact information. They contact me through the day. And then if they see something that I don't see, they share it with me. So the biggest thing right now is us staying in communication as providers and support staff, and then offering that to patients. Because a lot of times patients don't know that they can have these telemedicine visits. They don't understand what it is. So just letting them know that it is something that you offer and that you still need to see them.
That's me. Hi, guys. I'm the Human Resources Coordinator for Foot and Ankle and FASA Family Wellness. So let's take a deep breath because that's some heavy conversation we just had. So initially, I think when this all began, I'm pretty sure everybody's in the same boat. Nobody knows what's going on. Everything changes from day to day, but one thing remains the same is you have to have staff members at some point, whether it's 5 or 20 or 80 or however many staff you might have. The staff are in the front lines of your business, and they're the drivers essentially right now, because most of us that are in these roles are not able to be a presence in an office. Now, I can't speak for everybody, obviously, but I know for me personally, that's been a little bit difficult on my end just because I am very interactive with my staff, and they usually come to my office multiple times a week. They have lots of questions. So initially, me providing information to them has been a little bit difficult just on that end. So when we began this and we were kind of sifting through what's going to happen and the budgets, we all knew that at some point we were going to have to start cutting hours. And when we sat down and talked about it as a leadership team, we all said, look, at this point, we're just going to have to streamline it the best we can and just be as transparent with the staff as possible. So if I can say anything right now, I can say that in doing this, reaching out to the staff and saying, hey, you know, hours are going to get cut. Things are going to change drastically, but that's okay because we're going to get through it together. And I'm going to walk you through the process. So in stating that, we looked at hours and staff and patients and all that stuff came together, and we decided that if we were going to do partial employment or standby, we were going to do it based off of what was going to be more efficient down the road. Meaning that there are two ways you can do this with placing a staff member on standby or partial employment. Partial employment is if you can guarantee your staff member has 16 hours a week. If you cannot guarantee that your staff member is going to get 16 hours a week, you're going to have to place them on a standby status. But in doing so, we decided to do it in 2-week increments, meaning I would send them a letter stating that you're on now standby or partial standby status. This is your opportunity to apply for unemployment so that we can bridge the gap between you losing hours and you continuing to work. So, and in doing that, you have to be very strategic, because when I send them that notice, that's what they're going to give to unemployment. So we decided to do it in 2-week increments. So we made an Excel spreadsheet. So every time I sent somebody a notice saying you're now officially on standby, I would put the date I sent it and then the date I would need to resend the notice stating that they were on standby for another 2 weeks. Now, because of all this, standby usually works at a 4-week and an 8-week increment, but the government has now issued it up to 12 weeks, which is good because that means we have more time to work with the staff. Also, when it comes to ESD, Employment Security Department, and unemployment, I don't know how you guys have been handling that, but I've been taking a majority of the questions with the staff and actually walking them through the process and giving them all the documentation. So what I did is I sent them out like the unemployment guide. I don't know how often you guys are visiting the ESD website, but at this point I'm doing it on a daily basis. So if I was to recommend anything, I would recommend to have a roster for your staff of who they need to reach out for what questions they might have depending on what it is. If it's a clinical question, if it's, you know, an unemployment question, if it's a staffing question, They really need to know who they can talk to about specifics. And another thing is you have to be available to have these questions be asked. So for me personally, with my staff, and I have 80 staff members, just so everyone's aware, I want to be available to answer any questions they might have about unemployment, about their hours, about their pay, at any point in time. If somebody says like, hey Marta, like I have a question about unemployment, how do I do this, how do I do that, I'm just going to send them the information. So the best thing that I can recommend right now is be as transparent as possible with your staff, with the upcoming changes that are going to be happening with your staffing, with your hours, and with unemployment. Unemployment right now is a mess. It's ridiculous. It's very frustrating for most. People are getting denied, and then they're getting called, and then they're getting denied again. All these things are normal, but they don't know that. So do your research, and I will leave my email in the comments box, and you guys can reach out to me with questions, and I can send you all kinds of documentations. If you haven't already started putting staff on standby or partial employment, if you don't have a letter, I can send you a letter template. I don't how many staff you have or how many staff you don't have. So I can't just pinpoint it just off of, just off of what I'm saying. Sorry, I'm getting tired. So if I could recommend anything, it would be find a common ground of information to feed your staff. If you are reaching out to your staff on a daily or weekly basis and just sending them updates on ESD, Department of Health, OSHA, CDC guidelines, all this stuff is what they really want to know. And at the end of the day, your staff just want to know that you're there for them. If I can recommend anything, it's just making yourself known with your staff and saying, hey, I'm here to listen. I know that in branching out and networking a little bit with just some colleagues, some networking that I've been doing, the number one thing I've been hearing is my job does not tell me anything. They have all these meetings, they go into these rooms, they have these meetings, and I never hear anything from them. I want to quit, I want to leave. This is not how you do business. We want to branch away from that because our staff are very important to us. And when we get through this, we want our staff to come back to us. So just have an open line of communication. And in closing, we're going to do a Q&A now. And so feel free to ask any questions to Jamie, Brian, Dr. Hess, Jolene, and I, and we'll do our best to answer them for you.
Thank you, Marta.
Questions? No one has any questions.
While we're waiting for questions, just know that as podiatrists, we've been doing this from yesterday, today, tomorrow, but this moment in our practice careers is going to leave everything changed. So 6 months from now, when everything's back ramped up and we're kicking ass again and everything's good, I think we can anticipate that we'll be doing things differently. Telemedicine will be a forever new part of our practice. And so this is what we're trying to think of on our scheming meetings to see how this is all going to look then, not just today and tomorrow, but 6 months down the road, a year down the road, so that we're prepared, ready to roll out whatever's coming our way so we can be on the front lines to make it better.
I got a question for Brian. He talked about one of the requirements for the payroll protection was a transcript of payroll taxes. I just have one office. It's just a few employees. We use QuickBooks, and I'm not sure it has that. But my question is, and I did some reading. I was under the assumption that you could also use last year's average monthly payroll. Why couldn't you just take your W-3 that shows what your payroll was for the whole year of 2019 and use that and divide it by 12 to get your average monthly? Or am I missing something?
Yeah, so what would occur under that scenario? So let's say you did that. Let's say you took your W-3, right? And then you just divided it by 12. And when it comes to the whole 12-month thing, that's one of the areas that I don't think there's very good guidance, right? If I remember correctly, the actual terminology is 12 months prior to loan origination, right? So theoretically, that would mean sometime in April of last year through sometime of March or April of this year, right? But I've heard the same thing too, where, well, there's another document that just says the word last year. And this is also another government document, right? That just says the word last year. So do you mean literally the last calendar year of 2019 or the last 12 months? So that's one of those areas where I've not found the perfect, especially because I've read two different government documents that kind of contradict each other. So I'm just doing the 12 months prior because I feel safe under that scenario. But take 2019 if you feel best. But let's say you did take 2019 and you took that W-3. Well, if someone made over $100,000, you have to subtract them. You have to take out anything over $100,000. So make sure you do that. Then the other thing to keep in mind is that your W-3 isn't including the health insurance that you've paid, the retirement benefits that you've paid, the SUTA that you've paid, and you have to add all that back to your payroll because that's part of payroll. So the government says that we can add all these things. So when it comes to using QuickBooks for your payroll service, right? So asking a question to you, do you, who actually does the government filing for you that, you know, does your payroll taxes and all that stuff?
I do it myself.
Perfect. So then you know the 940 and the 941, you know those documents, correct?
Yes.
Perfect. So then those documents plus any, so we don't do any of that. It's actually one of the things I really love. I don't have to do any government filing here, right? We pay someone to do all that for us. But back in my previous life at my last job, so I was a CFO in the state of Florida, and for a while, I handled all the payroll taxes, myself and my team, right? So we also had to turn in a state unemployment tax in the state of Florida. So if you have to do that here, which I'm guessing you do,
yes,
that document, you do it by quarters, right? So you have that. So then just total up all the amount of SUTA that you paid during those 4 quarters, and bam, now you have your SUTA amount that you're going to add to your payroll. So that's one of your numbers. But then don't forget that health insurance, right? Because if you're paying $200 per employee per month in health insurance, that's $2,400 a year plus however many employees that you have, then now you can add that to your payroll as well, to your payroll cost total. So definitely don't forget that. And if you're doing any 401k matches, don't forget that either. So the W-3 is a good start, but it's not everything. You need more.
But would you recommend sending that W-3 at least in, or that documentation in as an attachment, or do you just wait and see what your particular bank wants in terms of any documentation? I guess is what it would boil down to.
No, sadly, the W-3 is not going to count. And the reason is the government has asked for one document that we know. We know for certain the government's going to want this one document. It's payroll register, right? It's not W-3. They have the W-3 already. They can pull the W-3 anytime they want, right? We filed it in with them, so they have our W-3. No, what they want is an actual payroll register. And why? Why would they want a payroll register, right? So what a payroll register is going to do, it's going to tell you who's made over $100,000. So the government's going to know, have they removed all the people that made over $100,000? The payroll register is going to tell you that, right? So what I did, just to, Jared, you said you have ADP. So what I did is I ran the combo bill for all of 2019 and then also for the first quarter of 2020. So I have everything the government's going to possibly ask of me. And this combo bill is going to have all the data that I need, including my health insurance, my SUTA, and everything like that. When it comes to QuickBooks, it should be in your QuickBooks file as well. It should be in there because obviously you have to have your costing in there, right? You have to know how much money you're paying and all those things. So would
it break down that payroll register? Would it be like for the whole year, or would it be would it do it by month? Because I know when I click on payroll register, it brings up everything, or something equivalent. It brings everything up. I mean, it goes on for pages and pages of each deduction and all that. Is that what you're talking about?
Yeah, so it's very similar to that, yes. So what you're going to do is you're going to do a date range, right? So this is going to be the fun piece. I personally think give them more information, right? If you're giving them all the detail, right? So mine isn't quite like that. So as an example, we get paid twice monthly, right? on the 10th and the 25th. So, and then, so each month, each person has 4 different line items, basically one for each of the weeks. So that means, you know, over the course of a year, someone's going to have 48 line items. Yours is going to be so much more detailed because QuickBooks really does break it down even more detailed. Mine, everything is on one row. So it's like, it's nice and easy. And then it has all the different columns that I need. Yours is going to be a little bit more intense. But if I was, say I was your CFO, right? Let's say I was sitting in that position. I would probably want to grab more detail and then let the government figure it out from there, because everything's going to be there. What's going to be important is that I can calculate it based off of that information. So if I can sum my gross wages, right, because that's what you're going to want. You want your gross wages. And I have somewhere that tells me how much is SUDA and how much is health insurance. If it has all those pieces, I'm okay. I'm okay. If it gives you more than that, who cares, right? Like my information I'll give to the government is going to be so much more too. I'll let them figure that out. Okay. And I'm imagining there is a very low audit risk. Not saying, certainly be aware that you could be audited. So I certainly don't want to say that there's no risk, but there seems to be a very low risk in audit. That's
okay,
possible.
thank you.
You're welcome.
So Brian, I have a question. So if you take out this loan and you use it on payroll and utilities and rent or interest on your mortgage, and you still have, number one, how do you report how you're using that money so that they know that you're using it? And number two, what happens if you still have money left over in the loan afterwards? Do you start paying interest on that, or do you just pay it back? Like what's kind of the deal at the end here?
So those are great questions right there. So when it comes to how, right? How do you show your proof? Canceled checks, that's one of them, right? You got your canceled checks. So this is what we're going to do. So I'll just tell you how FASA is going to do it. Terry, bless his heart, spent 2 hours at Wells Fargo today opening up a bank account, right? So what we're doing is we're going to open up a separate bank account that the money's going to go into. Then we're going to pay all of our expenses off of that bank account. Nice and clean, nice and easy, right? It's not being mixed in with anything else. I say, here, government, here's my proof. It's all there. The amount that I am asking for loan forgiveness matches the amount that went out of my bank account. So that's my personal recommendation. But even on top of that, what the government has mentioned, you have your canceled checks, you have your bank statements that show it. So you have lots of documentation proving that you've paid it. And don't forget, this is going to be treated as a cash method. I'm guessing everyone here is cash method, so you're probably okay. Not accrual. So that means if you're using your credit card to pay for anything, you have to have paid for your credit card already, okay? So if you paid it on your credit card and your credit card isn't due until after the loan forgiveness time frame, you're not going to get loan forgiveness for that. So keep in mind, this is all cash basis. So when it comes to, so let's say you got $250,000, right? That was your loan. And let's say you managed to get $200,000 forgiven. So now you have $50,000 left over that you're going to have to pay. So the interest rate is going to be 0.5%. Your first payment is going to be deferred for 6 months after you get your actual money. So let's say you get your money May 1st. Your first payment isn't due until November 1st. Before November 1st, you would have already had your $200,000 forgiven. So that means now you have $50,000. Keep in mind, the 6 month is a deferral of payment, not a deferral of interest. Your interest has been accruing in that time frame, and now 6 months later, you're going to be hit by that interest. But it's at 0.5%, so it's not something to worry about, right? 0.5%, you're never going to get interest that low. But on November 1st, you have to start paying that $50,000, and you have 2 years after that to pay it at 0.5% interest rate.
I have a question for Kim. If we're doing a video, we should be using the E&M CPT codes and not the 99441. That is just for telephone only?
The telephone is for, the telephone E&M codes were the ones that were previously used for just a phone call. But as of 2 days ago, they do want us using the 99201 through 215 series.
Okay,
For
so
phone call or video.
or audio or video.
Yeah.
Okay, so when would we use the 99441? Are they?
Don't use it.
Don't use them at all. Okay.
Mm-mm.
Okay, thank you.
I also have a question for Kim. How do you document the check-ins, the G2012?
So what we are doing is basically making a new encounter and documenting that as like a phone note and putting all the details through there, so that way we have it to refer back to if ever audited. So it just says, like, I'm going to throw my doctor I work with, but Dr. Burkhart spoke to patient A at this time, discussed this condition, phone call or voice messaging lasted for, and then the amount of time that it was spent. We save that into their chart, and then that way we can continue to add on to it as needed to add up for the time.
Gotcha. So what if it's over multiple days? Do you just pick whatever the first day it was initiated on to create that chart? Yep. Okay.
Yep. Over 7 days you have.
Gotcha. Thanks.
It's easy if they have the portal and they're messaging you back and forth, because obviously those are timestamped and it shows the exact communications back and forth. But I know a lot of the patients will text you guys, they will call you guys on your personal phone, but that time of your guys is just as valuable. And that way you guys should be billing out for those things that you guys are spending your time doing.
Perfect. Do you also keep that as position 11, or do you do like position 2?
Nope, 11.
Thank you.
It seems like from 2 days ago, they want us moving away from place of service of 2.
The interesting thing, we did some math, and in the month of April, if we don't meet our new patient goal, because we get a new patient and then we see them say 5 times based on the treatment plan you enroll them into for plantar fascia, for a neuroma, for all those things, you're going to miss the 5 visits. So the vision I have ahead of us is June could be our worst month if April doesn't have enough new patients, because of that kind of flow, that momentum that gets created by new patients. So that's why we're trying as hard as we can to hit our current patients. Hey, your daughter has this condition, chances are you do too, mom, or the reverse. And that often is true. And so we're trying to invite them to become a patient, you know, because this runs in the family. I know, Kim, is it Dr. Lehrman? Who's the guy that likes peds? Anyway, there's one podiatrist who only wants kids. And so he, no matter what adult he gets, he always says, you have to bring your kids in next visit for an appointment, and we'll get x-rays and baselines because we're going to prevent this from happening to them in the future. We're definitely not that good, but we're getting better.
We are contacting the primary care doctors around though, and letting them know that our office is open and we can get the patients in.
So I got a question. I'm not sure who would want to answer it exactly, but how's your protocol changed in terms of like, obviously with the safe distance thing, you can't treat feet and do that unless the person's over 6 feet tall. But what do you do in terms of the assistants that are actively treating and the doctors in terms of wearing masks in the exam room, things like that?
Kim?
Kim, you want to answer that one?
Okay. So with our limited stock of our masks, what we are doing is at this point, we assign one person a mask in the morning and we initial it. We're using it through the day. For the majority of our patients, obviously, you're assisting with holding the leg, with Una boots, that kind of thing. But other than that, you are down at the feet, so we just have them wear their masks and gloves and cleaning and sanitizing before and after with every patient. It does help too with us screening the patients before and their caregiver that comes with them at the door, because if they have any, if they've got allergies, as a lot of them are stating, then we just hand them a mask at the front, so that also gives us a barrier between us and them as well. Does that help answer?
Yes, yes, it did.
Is that kind of what you guys are doing?
Yeah, we did have one patient who, interesting things come out, that came into the room and informed us when she was in the room that her daughter had just returned from Italy and she'd had contact with them. And so we got the mask out real fast for her.
Yeah, I'll bet.
And but we wiped everything down twice that she had touched, you know. So we're trying to do, it's a good idea about the screening. We don't do that at the door, but we when we call all the patients the day before and we ask them, we tell them if you have a fever or anything, or if you develop it between now and when your appointment is, do not come in, reschedule.
Okay. If I walk in, they check my temp. I can't get in the building without being checked. That's the rule they have for no matter who goes into the building. So that's pretty helpful. And then I have to wash my hands in front of somebody. So they're pushy, which is good.
Now, are you doing that in all your offices? Do you have one of those electronic temperature, that you just hold up to the forehead?
We have different kinds of temporal ones. The regular ones, the temporal ones are the best, but you can't buy them right now. So
sure, yeah.
We've also done some parking lot waiting room stuff where we've had, patients that are really worried. We just have them wait out in the parking lot and call them whenever we're ready for them.
That's awesome.
I kind of want to mention this wouldn't be about the payroll protection program. This is more just me and being a CFO, right? Hopefully everyone has been preparing for the future, right? Because what the payroll protection program is doing for us is it's buying us a couple of months before, and hopefully this is all cleared up by that time frame. Yeah. But it probably isn't, right? Like, even if the worst of it has passed by June, we know that the patients are probably still going to feel unease for a while. And then like Dr. Hess was talking about, because our new patients are tanking, so as the payroll protection program has gone away, now you're going to be faced with a very small patient load, most likely sometime in June or July. And you're going to be back in the same position, hopefully not quite as bad. But I hope everyone is thinking about that and preparing for that, that this is just giving you a few months to prepare yourself and your staff for possible further cuts in June or July. We've done all of our calculations when it comes to that. And like Jolene was talking about earlier, we initially started with 4 different scenarios. We actually expanded it to 6 different scenarios. What I call basically what I thought was realistic, and then like a low, and then I did an ultra low. Like it can't drop lower than this type situation. And it doesn't seem like it's going to drop to that bottom, but it prepares us, right? So we know if we're at this level, we look like this as a company. If we're at this other level, we look a little bit different, right? And when I say look different, I mean when it comes to staffing, right? You look different at all those scenarios. And it's doing a mathematical calculations to see what is that optimal level at those different levels of collections. So I hope that if you're not able to do that, that you have someone that you can rely on to talk to about those type of stuff. Because that is probably the toughest thing. If you don't have someone like myself that can literally dedicate their time to nothing but that, this is probably a pretty scary and tough time frame for you all. I just hope that you have someone that you rely on and that you trust, that you can ask those questions. So just mention that.
Actually, on that line, I got a quick question. I think is it for Jolene. I'm not sure which one talked about the H&R, the time off. I've never not done much in terms of laying anybody off, so I'm a real novice at this. So what's the difference between partial employment and standby? And in terms of what you mentioned 16 hours a week. So does that mean like if someone at least is working 16 hours a week, they can go get partial employment, unemployment from the ESD? But if you put them on standby, that means they're not working at all and they can get full unemployment. Maybe you could expand on that a little bit.
Yeah, that was actually Marta that talked about that.
Okay.
I'll let her, that's okay. I'll let her go ahead and expand on that.
So there's a couple different things when it comes to partial employment and standby. Partial employment, you have to hit 16 hours a week. Okay, so if you cannot guarantee 16 hours a week, I would suggest putting them on standby. Now, the way that standby works is it works like this. I send you a letter, I'm saying you're on standby, but that means a couple of different things. It means that you have to be available for me to call you into work whenever I say so, okay? It also means that you automatically get unemployment, and you do not have to look for other employment while you are on standby. So it's a pretty strategic thing. So when we sat down and we looked at this, we said, can we guarantee the 16 hours a week? Absolutely not. Okay, we can't guarantee 16 hours a week. So we decided to do standby. So I sent them a letter. I stated you're on standby, whether they were working 1 day a week at this point or 2 days a week at this point. I still could not guarantee that they would get 16 hours. So I told them, you're on standby. Please make sure to be checking your schedule regularly, because we will be calling you in, or you will end up on the schedule. Once they end up on the schedule, meaning once they're placed on standby and we're calling them back into work, they then have to do their weekly claim still, but they have to claim those hours worked. Does that make sense?
So like if you call them in the middle of a week or something and they worked half time, then they, or, you know, or let's, whatever, 15 or 20 hours, they have to report those to the unemployment. And then I assume they adjust the unemployment compensation down.
Mm-hmm.
Okay. Okay. Now, but if they're on standby and there's no work at all that particular week, then they get their full unemployment.
Yes.
Right? Yeah. Now, what happens if you say, oh, yeah, we can reduce you down to 16 hours a week? How does that fit into what they get in terms of unemployment?
So it's based off of what they work on an average. So if you have a part-time staff member, so, okay, here's the thing. So if you're in Washington State is 32 hours is considered full-time. So anything under 32 hours on an average is considered part-time. So if you have a part-time staff member, let's say they're working an average of 25 hours a week, okay? But now you can only guarantee them 16 hours. Unemployment will make up the rest of those hours that they don't accumulate at this point in time.
Okay, but if they're working 32 hours or more, they're considered full-time.
Yes.
And then they would just say, okay, you're full-time, you get whatever unemployment minus the 16 hours.
Yeah.
Okay.
Mm-hmm.
I think most of my staff do 32 hours, so that's how it would probably work. All right, thank you.
So more than likely what unemployment would do is, because if they're considered a full-time staff member, but they're still having a decrease in hours, meaning if you were giving them 40 hours and they're now only working 32 hours, even though that's considered full-time, they would still do an average and base it off of that average, meaning they would still be losing quite a bit of sum of money. So they would still base it off of an average. So even if they were 40 hours and now they're 32 hours, I would recommend with them moving forward with applying for unemployment.
Okay, I get that, yeah. And obviously the unemployment can look back in their records and see how many hours were reported on for, you know, whatever they look back to determine that. Got it. Okay, thank you, that was helpful.
Just to be clear, they still need a letter for partial employment to be able to get the unemployment? Okay.
I don't think that they absolutely necessarily will ask for it, but it's a good thing for your staff member to have just in case, because unemployment is so overloaded at this point, you guys, that the system isn't set up for this. So it's denying people. And, you know, as soon as you're like, oh my gosh, I can't pay my bills, I just got denied unemployment, your staff are going to freak out. Okay, I've been going through it for the last couple of weeks. They're not denied. The system just isn't, it's not set up for this kind of volume. So my recommendation is, because you're going to have unemployment reaching out to you, you're either going to have it through a phone call, you're going to have it through a letter, some form of something's going to come to you. If they can present that letter to unemployment even before unemployment gets involved, meaning contacting you, it's much easier to start with versus later.
Yeah.
Does that make sense? Okay.
I got another question for Brian, I guess. If if a employee takes FMLA, do they still count as a full-time employee when we're making our calculation?
So that's a great one, right? We have a couple of folks that are right now on maternity leave, right? And that is a fun one. I've not been able to find that one perfectly. Like I haven't found that
Me neither.
perfect one. So what I'm going to do is I am going to follow it more as the letter, right? So I think the terminology is something along the lines of like active employees or something along those lines, right? This is not an active employee. So I'm not going to count you. You're not an active employee. And I always view things, so my previous jobs many times ago, I worked at a CPA firm for some brilliant guys, right? And they always looked at things, so much is gray in tax law, right? So much of it is gray. So now it's like, what color of gray is it, right? And this is one of those that I think it's not really that gray. It's, yeah, maybe it's a little bit grayish, but I'm going to take that risk. And I'm willing to tell Jolene and Dr. Hess that we're not going to count these folks. I think the audit risk is very low, and I'm not going to count them. Okay. But I do know that at least one of them is coming back. So I'm going to count her as one of my plus ones as my employees during the 8 weeks. So I'm going to count her as a plus, but I won't count her as a negative in the beginning.
Gotcha.
Just to piggyback on that too, guys, if the staff member is not on payroll, they don't count. So I'm in agreement with Brian. They're not there. So if you're not paying them, they're not active. So I would do the same thing as Brian is stating. I wouldn't count them.
That the form that's been going around, like Brian showed, asks for the number of jobs. It doesn't really say. And I read one place on the internet where that just meant positions, like how many W-2s you have, as opposed to full-time equivalent employees. Do you read it that way?
So I hate that. I mean, why does it say jobs, right? Why does all the documentation say FTEs and then the stupid application actually says jobs, right? So it's my understanding that that form isn't the finalized form. So it may end up being tweaked a little bit, but I am saying that I'm going to follow all the guidance. Your application is too vague, and I'm going to follow the guidance that tells me FTEs. Because if you read it the other way, right, I think that's going to be a negative for us. Because if you have a bunch of part-timers, but let's say those are the folks you let go, right? Because you always let go of the part-timers first, because you want to keep your full-timers. You're actually hurting yourself. So I'm not going to hurt us. So I'm going to read that as full-time equivalents, and I'm going to convert it like I talked about earlier, how I'm going to convert them into FTEs.
Where you said now anybody over 32 hours is just considered full-time. You don't do the division like you were saying, 32 over 40, but anybody under that, you just base, like if they're 10 hours a week or something, that would be 25.25.
Yes.
Yeah.
Yes.
Got it. Okay.
Exactly. Yep. That's exactly how I'm going to do that. Yep.
Well, that's in Washington state. So if you're in a different state, then it may be different.
Yeah.
What's considered
Okay.
full-time. Oh, okay. Gotcha. By the way, for all those in Washington state, just to kind of piggyback on what Brian was saying about preparing yourself for the next level and what this is going to look like, Governor Inslee just extended our stay-at-home order until May 4th this afternoon. So, you make sure you take that into consideration of what that's going to mean and what impact that's going to have on your practice, what impact that's going to have on the community that's going to impact your practice. So you have another month of this at least, if not longer. So, I mean, the plan, having contingency plans for every scenario you can possibly think of, and make sure you're watching that rolling cash flow is super important to ensuring the viability of your business after this is over. And we don't want to see anybody, this wipe anybody out of business, let alone our, fellow podiatrists in the community. So if we can help in any way, or if we can provide any resources as we can, that's what we're here for tonight to do. So be sure to, if you have any questions, please speak up and let us know, so we can try and help you as much as we can, or at least provide resources for you to reach out to.
One of my Indian reservations, they're only taking phone calls to direct people to telehealth, but they said that they anticipate that they're not going to be back. This person said she heard they were not going to be back running until June.
Wow.
So, I don't know if they have some kind of, information different than what we have. I don't know.
Well, there's a lot of speculation out there. We're trying to kind of stick to certain areas of facts because there is so much information. So, CDC and the governor and the president and those sites, we don't even take it from the news channels. We take it directly from Governor Inslee's website or any press conferences. So I don't know how long this is going to take. There's a lot of speculations, but what I do know is that he said this afternoon, the stay-at-home order, he didn't impose any further restrictions than we currently have, but he said the stay-at-home order will stay in place as things are now until May 4th, at least. And I think the numbers will drive the decision from there. But it is very easy. I think several weeks ago, right, Brian, we started looking into July, August of what that's going to look like,
Yeah, our plan takes us out to the end of August. Just from talking to Dr. Hess, that's what he saw really, right? That yes, it's going to be a few months of the actual stay-home order, but then it's going to be a few months to actually come back up, right? It's going to take a while. So I have all the projections. I feel good. I know it's not a typical thing to say, but I feel good because we're planning. So I feel good that we have the plan. And so unless things get significantly worse, this Paycheck Protection Program will make a massive, massive difference. It'll make such a huge difference. It will allow us to survive. We won't be killing it. We won't probably be hitting the budget number because we do a yearly budget. But depending on how it accelerates from September to December, it's possible we can end up hitting our net income bottom line number for our budget. So I feel good about that. It just depends on how quickly it accelerates and whether it accelerates like I'm anticipating, but we don't really know because we haven't really gone through all of this. But the plan makes a huge difference. Hopefully it helps put Dr. Hess's mind at ease a little bit, knowing that we have a plan in place. And if it hits at certain levels, we're just going to implement this plan, this plan, and this plan. Plans that he's well aware of. He knows what we're going to do. It makes a big difference, I would think.
And it does make a difference.
One thing I definitely want to urge is, based on the numbers of the amount of money that's being released for this small business loan program and the amount of small businesses that are out there and the amount of estimated small businesses that are in need, it's anticipated this money could be gone pretty fast within a matter of 7-10 days or so. So if I would really, and it seems, correct me if I'm wrong, Brian, but it seems that there really isn't a lot of negatives, if any, to applying for this loan. So I would really urge everybody to be on it in the morning to get their application in, because this may be some saving grace for your practice.
Yeah, so to give you an idea, Wells Fargo did 700 SBA 7A loans last year, 700. They're anticipating getting 40,000 applications a day. Yeah. So that just tells you how overwhelmed the system is going to be. So if I had to guess it's not going to be available tomorrow, I'm going to be ready in case it is available tomorrow, but my guess is it won't be available till Monday or Tuesday. That's what Wells Fargo told me. And it's not even the SBA, right? It's the lender side, because the lender actually has to create the website so that you can actually make your application, right? Because the lenders will not talk to anyone. My conversation, we were already in conversation with our Wells Fargo banker before this. So when I spoke to him on Monday, we were talking and I was asking him what the process would be before he knew what the process was going to be. And he told me that they had 2 SBA specialists in Wells Fargo. In all of Wells Fargo, they have 2, which makes sense because they have only 700 applications a year. So obviously, 2 SBA specialists are not going to be able to handle 40,000 a day. So it's going to be all automated systems. It's going to be a computer. You're going to upload everything. So you're going to have to know your stuff. And you have to do it yourself, because they will not help you. So just prepare for all that. And like I said, just be ready in case. And if you're not ready now and it's not available for you to turn in tomorrow, take the weekend as your opportunity to get all your paperwork, because it should be ready by Monday or Tuesday. But if you just think about Wells Fargo, right, for 40,000 a day, I don't know how many, how big each of the loans would be, but you can just get that sense that it would eat away the 349-ish billion dollars or so. It would eat that really quick.
Yeah.
Not saying that each person would get $1 million, but if each person got $1 million, that'd be $40 billion a day, right? But if you subtract that, let's say each person got $100,000, that's $4 billion a day. That's Wells Fargo doing $4 billion a day at $100,000. So it's going to go fast. So just be ready for it.
I have a question for Brian. I don't have any employees, but
okay.
I get paid.
Yep.
And my bank actually called me a couple of days ago. They're calling all of their customers. Columbia Bank was calling all of their customers to ask them how they were, let them know they were open, kind of like what Jamie was talking about, letting patients know, well, they were calling. And then I decided today to call them. But I think that there's still some way that I may qualify for the PP thing by the money that I take out for me.
So do you pay yourself an actual salary?
I don't pay myself a salary, but I take everything that's not expenses.
Do you pay, so that means you don't pay any taxes, like payroll taxes, right?
Well, I do as a self-employed person.
At the very end of the year. Yeah, when you're doing your taxes, right? Do you pay payroll taxes? Okay, do you pay quarterly? So if you pay quarterly payroll taxes, I think you qualify. If you don't pay quarterly payroll taxes, I don't think you would qualify. And the reason for that—
No, I pay my taxes quarterly.
Oh, your federal income tax. Yeah. Oh, yeah. With it
Brian,
captures everything.
Isn't there a provision that the application opens up the 10th for self-employed individuals?
Yes. So
I have heard that too.
The area that is tricky, and this is where I can't answer this question for you, unfortunately, is the requirement of payroll taxes being paid. Specifically, payroll taxes being paid, right? If you're not paying any payroll taxes, do you qualify? I don't know, right? My mother owns her own business, right? She's in Florida, and she only has business for herself. She used to have an employee, but she lost that employee a while ago. So it's just her. And she does the same thing, right? I do her books, obviously. So she does monthly payments for her end of the year taxes. So I'm doing all this for her as well. And I have not found something that tells me my mom's going to qualify. And that really
the other thing that I talked to my banker today, and what she said was, she told me to, they're telling all of their customers to apply for the disaster loan, apply for it. They said they don't know about the PP program yet, but they're taking down the names of, so I'm on her list of people to call as soon as she knows something about the protection program.
So I didn't talk about the disaster loan, but I'm with you. That's actually the route that I'm going to try to help my mom with, the disaster loan.
Well, I'm only doing it because my banker told me to. I'm not.
Do it.
Right.
It's not bad. I didn't have that. So I'll add that link to my Word document. So the disaster loan is nice because you apply for it, right? So you do all the information. It wasn't that bad, but they asked for some information from you. And if you get denied for that, you can still get up to $10,000 for free. $10,000 grant. Here you go. Don't have to pay it back at all. You don't have to qualify for the PPP. You don't even have to qualify for the disaster loan. I don't know what the qualifications are to get to $10,000, but you don't get hurt by doing it.
Right.
So definitely go for it. worst they're going to do is say no, but you may get lucky and get $10,000.
Yeah, which I'll take if they give it to me. So,
Heck yeah. Yeah.
thank you.
You're welcome.
So does anybody want to share, we're coming up on the hour-and-a-half mark here. Does anybody want to share any specific challenges they have in their offices or anything that's working really well in their offices with the group?
Anyway, guys, the reason I decided to do this and wanted to do this is I feel blessed and super lucky to have this team. These guys, literally, this is their full-time world of what they do. They do it really well. And so I know that a lot of people in Washington are sole proprietors or a single doc or a couple docs. And so we just are lucky enough to have this team. So wanted to put this together. I don't know if it makes sense to try to do it again in a week and see what changes and new things we've learned and what things you guys have learned that you can share back. If that makes sense, we could try to do this again next Thursday. These guys are on webinars, I don't know, every day. Literally putting time in, talking to we have memberships into these really cool places where hundreds of doctors are on these webinars and Brian's teaching them what to do. So that tells us that we're doing the right thing. So these guys are on it.
And next Thursday at 2 o'clock, the APMA is having a webinar. I just read my emails.
Yes, I saw that. That's with Markham S.
That's with the group that Brian shared his screen with.
Yeah.
Yeah. Well, I really appreciate you guys putting this together. The one other piece of information is that the Washington Podiatry Association Board, we're going to meet in the next week or two, and we're going to come up with what are we going to offer the membership in terms of continuing medical education. And then the other thing that I read was I had an email, if you are trying to, if you need to relicense between, I think it's between April and September, check your emails that they are, if you haven't gotten your credits, it's going to be okay.
Okay.
I can't give you the exact wording of that, but if you're looking for that particular thing.
I think they actually,
it was from DOH.
Yes, they extended it until
September 30th of 2020.
Right.
So if you guys have any staff that ask you about licenses or anything to do with that, they are not requiring, DOH is not requiring that you have to have an active license or renew your license until September 30th of 2020. However, they will not waive any fees for that. So I told my staff today that it's absolutely fine if you can't afford to renew your license. Completely understand. I just asked them to reach out to me and let me know so that I could have a list, so I can make a list. Because I penalize my staff, I used to, if they let their license, if they let their license go, they would be taken off the schedule immediately. So I did let them know today that that wouldn't be happening, but that doesn't excuse them from making sure that they don't do it in the future. It just means that we are understanding that they're having a rough time with finances and that shouldn't be their priority right now. Their priority is to keep working, keep their, their self steady and take care of their families. That's their priority right now. So.
And the one other thing from the Podiatry Association thing that we are going to be discussing is the dues and either partial forgiveness or how much forgiveness or whatever. So, you'll be finding out about that, but we haven't had our meeting yet, so.
Okay. So I think the plan for us will be, we'll do this again next Thursday. I'm not sure what time works well. And we can just touch on it again and see if we've found things out. The APMA meeting will have happened. And if my team's up for it, I think we could make ourselves available then. What do you think?
We were hoping for a 4 o'clock next Thursday. Would that work for everybody?
Yeah, it works for me.
I think by then I probably would have already completed the application, hopefully. So if anyone hasn't completed the application by that Thursday, I would be able to give you like a real world scenario of what actually occurred.
Yeah. Okay, so we'll plan on this next Thursday. What is that? The 9th at 4 o'clock.
Okay.
Yeah.
Come with your questions next week.
Wins and losses.
Before we go, one thing I just wanted to bring up is just an idea for you guys to think about of the patients that are canceling currently at your clinics. Make sure that you have some kind of Excel spreadsheet of who's canceling and then when their appointment was and what time, so that way when things do ramp back up, you can start calling them and letting them know, and you're not losing the patient.
Thanks. Cool. Appreciate you guys.
Terry?
Yeah.
It's Jim.
Hey, Jim.
Can you hear me? Yeah. You know,
Yeah.
I was just going to say, maybe this is being master of the obvious, but in your personal life, if you have mortgages, your vendors at your clinics, a lot of our vendors are really cooperating and deferring our payments for, 2 months, 3 months, our leases and such. So, because it wasn't a topic tonight, but just personally.
And Brian
you're able
and
to do that.
Jolene, I think are doing just that. They've made contact, I'm guessing, with all of our lease holders and all those things, and
But I mean,
Epifix
even
people and
in
the
your
expensive
personal
ones.
life, if somebody in their personal life wanted to do something with their mortgage or credit cards, they're very willing to work with you.
That's
You didn't
cool.
know. Yeah.
I didn't know.
Yeah. If people need that, so.
We may.
Yeah.
And anybody paying student loans, those federal loans are being zero interest, nothing being added from April through September.
Wow. That's good to know.
Okay. I'm gonna buzz off. See you guys later.
Okay.
Ciao.
Thank you.
Thank you.
Thanks, everybody. Appreciate it.
Bye.
Thank you all for attending.
Thanks,
We'll see
Terry.
you next week.